The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, small things you can do to improve your smile. With us, we have an expert on the topic. She is America's cosmetic dentist, Dr. Rene Dell'Acqua. Dr. Dell'Acqua, welcome to the program.
Thank you, Randy. It's great to be here.
It's been a long time since you've been on the show. You brought some new photos. What are the different categories? We'll start there of cosmetic dentistry that you do.
I'll start with the most simple category, which would be whitening. Patients come in for whitening. They want a little boost to their look. They want to look refreshed, and they want their smile to look younger. So bleaching is always that first step, the least invasive procedure that they can have done. Invisalign is a wonderful way to straighten the teeth without anybody knowing.
Is that pretty popular, by the way?
It really is. I have a lot of patients that are undergoing Invisalign. Sometimes they come in looking for veneers. They think that they want porcelain coverage on their teeth, and really all they need is to change the placement of their teeth. So we are able to do that with Invisalign.
Okay.
Bonding is another wonderful option for people who have spaces or misshapen teeth. We can put bonding material on their teeth to make their smile look perfect and refreshed.
Okay. Now, how important do you think the smile is, by the way?
I think the smile is the most important, absolutely the most important, yes.
Boy, that surprises me. Dentist says that.
But it really is, Randy, think about it. When you see somebody and you meet somebody, you pass judgment on them on that first meeting. Do they seem nice? Do they seem uptight? If someone seems nice, you want to be their friend, don't you?
Yes,
But if they seem like they don't want to smile, you're wondering why. Why don't you want to smile? So it also gives us a feeling of self-esteem. When people are smiling, you look at them and you say, that person feels good about themselves, and I like that, and I want to be friends with that person. So to me, and I believe too, that people who are unhappy with their smile come off as being a little more aloof and not so friendly. But in my experience with my patients, I have had people come through the door very quiet. When we're done doing the cosmetic dentistry, they have their huge personality has returned, and then they
because of their smile.
Well, yeah, and they tell me the stories how over the years they've slowly gotten into this phase where they don't smile in pictures, and people don't come up to them and introduce themselves anymore, and so it changes.
Because I know women that don't smile; they don't look approachable.
Right.
And but a smile is important.
I think it's incredibly important, and it ages. A smile can age someone so much.
Age?
The color of the teeth, the shape of the teeth as teeth wear and they start to be more square or boxy on the edges, or you start seeing chips and shorter teeth. People just look older. I've seen young patients with severe grinding issues whose teeth are very short, and they look much older than their years.
Interesting.
So simply by restoring those teeth to what they're supposed to look like, they look younger.
Now, you do regular people coming
Absolutely.
in, but you also like CEOs, celebrities. You have a celebrity following as well.
Do.
People travel great distances to see
We have people from from Europe and Canada, and the desert's such a mecca for people from all over the world to come and spend time during the season. So we're fortunate that we are able to meet them and
when people ask me, by the way, and I try not to endorse the doctors on the show, but I've seen your work, by the way, and probably, if not the best, or some of the best I've ever seen. I mean, natural look, because I feel like I could spot veneers walking down the street. I mean, they're big and bulky.
Well, and I would agree with that, because I can't tell you how many places I go and I see people, and the first thing I see are their teeth, and I say, whoa, and patients come in and they ask me, they say, I don't want those veneers, because veneers look like horse teeth, and then they do say that, because the veneers that they know someone has, if someone knows you have veneers, they weren't done right. They shouldn't look like that. They should look like natural, beautiful teeth. And with the technology we have today and the amazing artists we have in the labs today, that doesn't have to take place. So there are each doctor has their own style. So there are different styles and people who prefer different looks.
You like the natural.
I personally like to make people look natural, but better, refined, fresh. Refreshed is a word I like to use. I want you to be you. So if you came into my office, Randy, I'd say, Randy, I want you to be you. I just want you to be refreshed. Do you have a backdoor celebrity entrance if I wanted to go? We have a sneaky entrance, so they won't. The paparazzi won't be there, Randy. You'll be okay.
Good. But so when somebody comes in, they come into you and they want to pick their smile up a notch.
They do. They want to, and most people don't come in and say, change me. They want to be themselves, but they want to be the best themselves that they can be. So.
Okay.
They want to.
Now, the desert is one of those places. It seems like the women are probably some of the most attractive women in the world.
They
take care of their skin, their nails. Do you ever see some of these? Because I see them working with some of the surgeons, that they've got an older smile. And
It's
they're
true.
knockouts otherwise.
But you know why, Randy? So many people are afraid of dentistry. They don't understand how easy it can be. I can't tell you how many of these cases I do, whether it's 2 teeth or every tooth in their mouth. When they're done, they can't believe how easy it was. Because
Really?
they have these thoughts in their mind, maybe stories from their parents or stories from themselves when they were young, horror stories that they have from dentistry, and it's just simply not like that anymore.
You do some light sedation or sedation?
We do. We do sedation for all of our cosmetic cases.
Is that popular, by the way? Or all of them, you say?
Incredibly popular. In every single cosmetic case I do, if it takes more than 2 hours in the chair, my patient is sedated. And that's because I don't want anybody to feel like, when is this going to be over? The procedure itself isn't stressful for the patient.
I like what you said in the green room over there. You said, because I was talking about in this economy, you said you're very busy,
Yes.
but invest in your smile.
Absolutely. How can you go wrong investing in yourself? Take care of your body, take care of your smile, take care of your skin, eat well. You can't lose.
You can't
So
lose.
there's no economy where taking care of yourself is a bad idea.
Yeah, definitely people, are perceived, that people that smile are perceived, and that have nice teeth, healthy, more energetic,
Right.
more put together. Very, very interesting. And so is it more men than women, more women than men?
I really think it's about 50-50. We have we'll have 1 month where we have more men coming through, and the next month we have more women. So it really, at the end of the year, I would say we have 50-50. Men are just as concerned about aging gracefully as women are. And they're
Okay.
just as concerned about looking appealing and looking successful as women are, looking young. So the women come in for different reasons and the men come in for
Are the patients getting older and older for cosmetic dentistry nowadays?
I think so. I think that people are understanding.
'Cause 70 is so young
well,
today.
But in the desert, 70 is young. People
Yeah.
they're out playing golf. They're enjoying outdoors. They're doing all these wonderful things. They're not aging. Inside, they feel so young, and so they're making sure that their exterior is matching the way they feel. So they're coming in. I've got patients in their 80s coming in and having cosmetic dentistry done, and you know what? They look amazing, and it gives them a little kick in their step, and they feel great about themselves.
Do you
It's
see self-esteem
wonderful.
changes just by changing their smile?
I see huge self-esteem changes. And I deal with patients that sometimes they come in, they're very quiet, very meek. They get their teeth done, and there's a whole different situation going on when they're done.
Really?
And it is so much fun when they come in with a new hair color or a totally new style of the way they dress, or their makeup is different. And
Is it like
maybe-
the ultimate accessory? I mean, in your mind?
It is the ultimate accessory. It is.
So in the desert, and I want to back up to that question, when you see these women that look fabulous, but they're not smiling or they're hiding a
Right.
smile, you think it's their fear of the dentist?
I do. I really do.
Do people still say, no offense, Dr. Dell'Acqua, but I don't like dentists?
Yes.
You do still hear that?
All the time. But when we're done treating them, they say, if I would have known it was going to be that easy, I would have done this a long time ago.
Can people be too far gone for this,
No.
cosmetic? I mean, do you hear people say, doctor, you've never seen anything this bad?
Everybody says that. Everybody thinks
do
they're the
really
worst.
say that?
Well, yeah, most people
I mean,
think
every
that they
day
have
you
the
hear
worst.
that?
Every day, someone comes in and says, "I'm embarrassed for you to see my teeth," and there is nothing to be embarrassed about. Let's just make you feel good about what you have. And there, like you said earlier, there are minimal things you can do, and there are big things you can do, and there's everything in between. So based on how someone feels and what their end result, what they're looking for themselves, what's going to make them happy is what's important. And I try to really listen to what my patient is telling me. When they're complaining about their smile, I'm really listening to the cue words. What are you complaining about? So that I can understand, is this someone who wants to straighten their teeth? Is this someone who wants perfect Hollywood smile? Is this, where are we going? So we can decide, are we doing minimal? Are we doing maximum?
I think you told me this on our last interview, that sometimes you see tears. That means when it's
yeah.
all done and they look at themselves in the mirror.
And that is, for myself and my entire team, those are the moments that we can't wait for those moments, because we know that we've really achieved something great. And the gratitude that patients have. I mean, we do this. This is our job. This is what I do. This is what I wake up and do every day. But
You love
for someone
this.
to hug me
Okay.
and to have tears in their eyes and to know that I made them that happy, it's incredible. It's absolutely incredible. So cosmetic dentistry is, it's very exciting, because you are making changes for people that really changes the way they feel inside, which changes the way they project themselves to others.
When should somebody
Celebrate.
do something about it?
When it bothers them.
Okay.
And,
okay,
and when I say that, Randy, I have patients that come in that I think would benefit from cosmetic dentistry, but they're general dentistry patients. They're having their teeth cleaned, we're checking their teeth, we're doing comprehensive dentistry for them, we're not doing cosmetic. I do not tell somebody that they should be bothered by their teeth. If it doesn't bother them, it doesn't bother me. But if they tell me that they're disturbed by the color, or they're disturbed by the shape, or they're disturbed by the placement, which people usually do eventually, once they gain that trust or they feel like it's okay to not like their smile, they will admit it, and then they will ask me for help.
So let's talk about some of these photos.
Okay, great.
What are we going to look at?
Well, the first one I have for you, Randy, is pretty significant. This is a gentleman, a wonderfully outgoing gentleman, a very, very successful gentleman. He came in. He was actually coming in because he had pain. He was having TMJ pain, he was having facial pain, it was chronic, it had been going on for 6 months or more. He obviously had missing teeth, there were reasons for his pain, so we actually did a full mouth reconstruction on this patient, meaning we put crowns on the implants, we put crowns and veneers on all of his remaining teeth, and in doing so, we rehabilitated his bite completely. So we made his bite the right shape and the right size for his jaws, for his bony architecture, so that he would be comfortable. And the day that we did the treatment, the day that we removed old dentistry, and the day that we put the temporaries on his teeth, he was out of pain. Now, I don't claim to be a pain doctor. That's not what I'm doing.
Sure.
But I do rehabilitate mouths that need rehabilitation.
But this was a person, though, that never smiled. I mean, they hated their smile.
This gentleman did not smile. He had great personality, absolutely. And after his treatment was done, he was smiling. And he looked so much younger. You can see the difference in the color
those are
of the
good-looking teeth. Yeah.
You can see, and I have this retracted view, and I know that you don't like this retracted view
Well,
because it's not
so
terribly
good.
attractive. And I know, and for people sitting there watching this, it's probably not their favorite thing to see. But I think it's very important that people are educated in what they're supposed to be looking for when they're looking for cosmetic dentistry. The gum lines are so important. You don't want bulbousness or bulkiness at the gum lines.
Well, it looks clean, by the way.
It's clean and fresh,
and
and you've got healthy gums, you've got healthy looking teeth, and the shapes of the teeth, if you look at the before and you look at the after, you can see the wear or the facets or the flat edges and the broken and the chipped edges on the teeth before from the severe wear, and then you see these lovely, softly formed edges on these teeth, which are youthful
And that's a male?
teeth. This is a man.
Yeah, he looks much younger,
And he looks fantastic, absolutely fantastic. Here's another patient, Randy. This woman came in and she was unhappy with the color of her teeth. And if you take a look at her teeth here, not only was the color a little bit dark, but she also had worn her edges down, which really aged her smile. She wasn't complaining about that. But once we discussed all of the things that was concerning her, we came to the conclusion that we needed to do some veneers on the top and some veneers on the bottom to actually give her the look that she wanted. You can notice in the picture how dark her teeth are at the gum line and the lowers.
And those wouldn't respond to whitening? Just bleaching?
Well, they will. She has some old bonding and some old dentistry on the top teeth, and old dentistry does not bleach. So yes, we could have bleached her lower teeth.
Like old crowns are what you're telling me?
Old crowns, old veneers, old composite material, the bonding material, that doesn't bleach. So with her, we could have bleached her lower teeth, but that still would not have made her happy on the top. And if we would have bleached the lower teeth, we would have been confined to using something that sort of matched on the top, which wouldn't have given her what she was looking for. She wanted something a little more wow, a little more pizzazz.
Okay, all right.
So this is how we finished her case. We actually did 10 veneers on the top, or actually 12 veneers on the top, and 12 veneers on the bottom.
Very nice. And by the way, when I look up close, and by the way, if we zoom in on that those don't look like veneers.
They don't.
I'm not trying to side with you too much, but this looks good. I mean, these look like real teeth, because I always feel like I could spot veneers walking down the street.
And you can oftentimes, but you can't spot my veneers, and I love that.
Okay.
That's fun. That is the fun part of my job.
So in the desert, if somebody has a beautiful smile, and they're over 40.
They probably have veneers.
Dr. Dell'Acqua smile.
It's possible, yeah. But I want you to look, well, as you're saying this, it cues me to show you something about this smile, because I like to be a little educational so that people understand what they're seeing. These aren't just porcelain veneers. These are porcelain veneers that are contoured to look like natural teeth. They're not bulbous and bulky. The material is very see-through at the biting edge. You have that translucency that natural teeth have.
You can see through it.
You can see through it. The teeth have a vitality to them where you actually feel like you can see into them, as opposed to a very flat look, which you often see with porcelains.
Those are cheaper veneers?
Well, I'm not necessarily going to say they're cheaper. I'm going to say that the lab work is not, the materials aren't the same as the materials that I'm using. I never want to say something's cheaper because I don't know what people are charging for what they're doing. But I want to say that if you want the best outcome that you could possibly have, this is the material that needs to be used.
Okay, good.
Okay,
good.
It's the most natural looking material. Okay. I have another. This was one.
I see this from here. This is really dramatic.
Okay, don't look. Okay. This is one of the most incredible cases. This is one of those people who came in and said to me, I'm embarrassed about my smile. I used to be known for my smile. And she says, I've finally worked up the courage to do something about this. It's taken me 20 years to work up the courage to do something about this.
Wow.
And this is her before. I want you to take a look at that, Randy. Now, this is a situation where you have a patient that feared the dentist. She didn't want to go in and have regular routine care. She feared the dentist. She started to have problems, and instead of addressing them, she just decided
Problems
to ignore
you mean
them.
like pain or hard to chew? Like
Well,
eating?
she was having pain. She was having difficulty eating.
Okay.
She didn't want to smile anymore. She got to the point where she would see a picture of herself and she wouldn't smile. And she said, that's not me. I'm a really outgoing person. People used to like me. They used to come to me and they used to want to be my friend.
They tell you this on the consult?
They tell me this.
Wow.
So with her, we actually had to have each tooth extracted. Each tooth had to come out.
Okay.
All the teeth had to go. She waited too long. If she had done something maybe 10 years ago, we may have been able to use her own teeth, but she waited too long. But that's okay, because we were able to fix everything. And there was not one day that she was under treatment that she didn't look finished. I'm going to show you her after. Now I want you to remember that each and every one of these teeth is on an implant. There is no natural tooth in here. Every single site has an implant in its place. So while she was undergoing all of this treatment, from day one that we started her treatment, we placed beautiful temporaries on her teeth that looked like these permanents. So she went through all of this work. She is about, I want to say 52, 53.
Okay. Because in the before picture, it looks like an old mouth. That's why I was saying.
Well, it does because of the destruction. You've got spacing. You've got old dentistry. These are the kinds of crowns you want to avoid. They're flat looking. They're bulky. They're bulbous, and they've moved. So she's got spacing and all kinds of things going on. So when you see her on the follow-up, she's acting like her old self. She's her old self. And the most exciting thing about working with her was she so appreciated it. She so appreciated that nothing hurt, and that she got through all of this so easily, and that we held her hand through everything. She never had to think about what her next appointment was or what was going to happen where, because we obviously don't do surgery, so I work hand in hand with specialists who do that surgery. We walked her through everything. She never had to worry. She always knew that she would look great, and that when she was finished, she would have a healthy smile again.
Interesting.
And she's just so dynamic. So
Good for
she's
you.
just been such a pleasure. But let me skip to another gentleman now.
All right.
We'll kind of switch tracks here. We have a lot of patients that come in with spacing. And people that have spacing like this, their teeth, he still looked great. I mean, he was still a great looking guy. But when we fixed that space and we fixed those biting edges, if you take a look, I mean, his front teeth were longer, his side teeth were shorter. Well, we like that, right? That's part of a youthful look, but not to this extreme. We don't want them that different from each other.
So is this another person that he hated this look?
He hated it. I didn't tell him to hate it, because some people love their diastemas. Diastema is the space. Some people love that, and they would never change it. Think about Madonna. She has her space. She's never going to get rid of it. But he didn't like it. It bothered him. So we placed veneers on his front 6 teeth, and you can see the difference in the smile.
I laugh because, it is a big difference. And I can't even see the rest of his face, but it looks good.
It's a huge difference. He looks like a totally different guy. And you go from having a smile that maybe he looked very young with his teeth the way they were before, and now he looks like a man, if that makes any sense.
In a job interview, by the way, because I'm thinking, the Wellness Hour, we employ people, and I think that if you put these two people side by side, the perception of the second guy is more squared away.
Absolutely. But he's just as squared away here as he was here, Randy. But your perception is that this gentleman is more squared away. And when we talked about some minor things we can do, you can't see his lower teeth in the before picture, but we did reshape his lower teeth. We did a little recontouring of the enamel or the tooth structure so that he didn't have to do treatment on the bottom teeth. We had some edges that were sticking up and some things that weren't quite right on the bottom, so we just finessed those for him. Put the beautiful veneers on his top teeth, and he looks like a rock star.
Interesting. We're going to take a quick break, but one of the things that I thought was interesting is you say that people say, I've heard about you or I've seen you on TV for years, and I've been thinking about doing something for years, and they finally do something about it.
Usually,
the people put it off and put it off.
They do, and there are a couple reasons that people will finally come in. It's a grandchildren. Kids say the darndest things. Yeah. They say the darndest things. Grammy, what's wrong with your teeth? Or Grandpa, how come you have dark teeth?
And that motivates them to do it.
That motivates a lot of people. Their grandchildren, sometimes it's their children that will say something. Sometimes it's a photograph they see of themselves at a party. They're with their friends, they're out to dinner, they see a photograph and they realize that their smile is no longer what it once was. It's that one moment where someone goes, aha, I need to do something. And then they come
I need
in.
to see Dr. Dell'Acqua.
And they may have known about
Okay.
veneers for 10 years and never really been interested. And then all of a sudden they start seeing something in their mouth that wasn't there before, or maybe it was there before, but it just didn't bother them before.
Are you a perfectionist, by the way? Do people tell you that?
I am an artist and a perfectionist. So I don't see what I'm doing as being a perfectionist. I see it as being an artist.
Really?
But it's a
So, you know,
absolute
I'm always
pleasure.
telling the public, and I'm not trying to endorse you, and I refer people to you, by the way. They say, who's the cosmetic dentist in the desert? They'll call me. And I always say you.
Oh, thanks.
Because I've seen your work, by the way. But you know, I say, go to somebody, look at their work, because I think the perception is that everybody's doing it the same way.
Right, and I do have a picture
I even
to
see
show
ads
you.
in newspapers of terrible,
Right.
phony, blocky
Right.
teeth. And I'm thinking that the doctor must not even see that.
Right. Well, that
have to have
is
an eye, I
that's
guess.
that's one of the reasons that I like to show these retracted views that are a little bit scary for non-dental people to see these lips pulled back and these teeth and these gum
Yeah,
lines.
yeah.
But I show it because that is one of the things that, as a consumer, patients should be asking to see. Whoever they're seeing, they should be asking to see their work, and they should be asking to see what those teeth look like at the gum lines. Teeth are not one color, Randy. If
Okay.
a dentist is putting a veneer or a crown in and it's one color from the gum line to the biting edge, that's a terrible look.
Does that happen?
It absolutely happens all the time. They order one shade and that's the end of it. Teeth start at a darker color at the gum line, and they, as a gradient down the tooth, become lighter and lighter and more see-through as you get to the biting edge. That is a natural tooth. So if you are not putting that into your porcelain, if you're not asking your laboratory for that kind of an end result, you're cheating your patient of a natural look. Now, if someone doesn't want a natural look, all one shade is great. But I have not had one
Okay.
patient come in and say, hey, can you do me a favor? Can you make me look like I have veneers? They
Big
don't
phony
ask for that.
veneers.
Right.
Interesting.
There
We'll take
you-
a quick break.
okay.
We come back, more of these photos.
Great,
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're with America's cosmetic dentist, Dr. Rene Dell'Acqua. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Rene Dell'Acqua, America's cosmetic dentist, and we're just about out of time. But you've got some more photos. Let's kind of...
I do.
Show
Well,
us
you know,
what
Randy,
you're doing.
I'm gonna go through these
Okay.
pretty quickly, okay? Because I have some beautiful things that I really want to share.
Okay.
This one that I'm going to show you right now is something we could do a whole show on, but I'm going to make it quick.
Oh, we
Okay.
could, okay.
This patient came in with old veneers, 6 veneers, and all she wanted were those
Wow.
veneers changed. She didn't notice that her bite had collapsed. Now I want you to look.
What does that
at
mean,
this.
her bite collapsed?
Well, look at the picture. You can't see her bottom front teeth. They're completely hiding under her upper teeth. So when you put the before next to the after, it's really easy to see how much of that lower tooth you're supposed to be able to see. So her
Nice.
bite collapsed, meaning the lower jaw was too far closed because the biting surfaces of those teeth have been worn down over time. Now, like I said, that's a whole show unto itself. So I'm going to skip past it, but I know
Sounds
that
like an exciting show, by the way.
it actually, no, it
To
really...
you,
no.
okay, well, that's good.
No, it would be exciting to you too, I promise.
Okay, sounds
This kind of
like
stuff
it.
gets me really excited because
Okay,
it makes such a
okay.
big difference. This is the kind of treatment that actually changes a patient's face. It's like that
Okay.
non-surgical facelift, we call it, because we're actually rotating the jaw downward to open that bite, which tightens this tissue and makes a patient's face look much younger. So, whole
Very
show on its
nice.
own, but I just wanted you to
Very
see
nice.
that.
You say that there's a lot of grinders that are in denial. I mean, you can actually
I
see.
would say that 99% of my patients who are grinders tell me that they do not grind. But I know that they grind
Because they're asleep when they grind.
well, they're asleep when they grind, but they've ground the tips and the points off of all of their teeth, and those are the protectors of your front teeth. And I have a case.
So
well,
they're
I'll show
headed for
you.
disaster, by the way, without
Yes.
going. Okay.
Yes, and I'll show you. I'll show
All
you one of
right,
those.
all right.
This is a beautiful woman in her 40s. She came in.
Wow, that's
her,
an old smile.
Her front left tooth was going to be lost. The tooth actually had failed. There was a root canal done on the tooth a long time ago. The tooth was reinfected. That tooth is going to be lost, okay? That is one of the worst things anyone could ever tell someone is that, by the way, you're going to lose your front tooth. So, you know, panic. How else are you going to feel? Panicked.
Yeah.
How can I lose my front teeth? Everybody's going to know. So her front tooth was taken out. She at no point during her treatment looked like any tooth had been lost. I want you to see her after. We actually
Wow.
placed a crown on the implant. If I was to show you the retracted view, which I know you don't want to see, you would see
That's the pulled back
that's
lips.
the pulled back view.
Okay.
You would see that this tooth, the front left tooth, looks exactly like the front right tooth coming out of the gum tissue. So we
Now that is beautiful work, by the way.
Thank you.
Good for you.
Thank you. She was so happy. She said that we actually got the shape to look exactly like what her teeth looked like when she was in her 20s. So that made me happy because I hadn't seen a before picture. I just looked at her face and thought that this would look incredibly natural on her, and it did. It was
Do
really
you know
fun.
right away, by the way, when they come in for the consult, I mean, even though you're listening to them, but do you look at them and say, "Oh my goodness, this is going to be good"? Do you know
Well,
early?
I do. I know pretty quickly. I know what I'm going to do before I look in their mouth usually, because as they're talking to me, I can see where their lip line is. I can see kind of how their facial expressions are when they're speaking, so I can
Do you
see.
get excited
I
about
do.
it during
I
this?
do. I do. I get excited once they tell me what bothers them, because then I know how I can help them.
Okay.
Because I can do cosmetic dentistry on just about anybody, but where's the result? The result is when a patient has a concern and I can help them with their concern. So that's the exciting part.
All right.
Oh, here's another beautiful
Oh, my
woman
goodness.
in her early 50s. She
a
had
grinder,
worn
by
her
the way?
teeth down. She's a grinder. She'd worn her teeth down. You see those biting edges? The biting edges of those upper teeth do not go along with her lip line. So you see this S-shaped curve. So we were able to restore that for her. She did need a full mouth reconstruction like we've talked about before, having to cover every tooth because we have to actually rehabilitate her bite. There's no room to make the teeth the right length without lengthening
All right.
the back teeth. And so this is her after.
Wow.
Incredibly natural and soft. You would never know that she's had anything done to her teeth. She looks so natural.
Now, I know you want to fit all these in, but we're running out of time. So what I'm going to do is we're going to offer the whole interview on our website at wellnesshour.com. They can just
Great.
put in Dr. Rene. I'll give you the footage too for your website. Great stuff. Thank you so much for coming on the show.
Thank you so
Really
much,
good.
Randy.
You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, the whole thing, you go to our website at wellnesshour.com. You could type in Dr. Rene Dell'Acqua, and if you can't spell Dell'Acqua, just put in Dr. Rene. You'll find her interview there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.